As the great Jeremy Irons once said,
Be prepared.
very nice. Now, why am I telling you to be prepared? Not because this song is potentially the greatest villain song of all time, or because I'm a villain myself. It's actually because every September we celebrate Preparedness Month. When a whole community plans and prepares for disaster, fewer individuals need emergency care or end up in situations that might become dangerous. In Nebraska, this often looks like empty grocery shelves right before a snowstorm, or your neighbor's farm equipment grading roads after summer flooding. We know that preparedness is important, but what does that have to do with public health? Way back in 1999, the CDC started the Public Health Emergency Preparedness Program, PHEP, to prevent and respond to bioterrorism. Public health protects our community against bioterrorism because we track things like botulism, anthrax, and smallpox. If a cluster of diseases is identified, we try to find the root cause in order to prevent illness, among others. September 11th, 2001 changed the United States and public health emergency preparedness forever. Congress dedicated $1 billion in funding to state and local communities to rebuild preparedness and emergency response capabilities nationwide. Public health professionals began using emergency response terminology in order to be able to communicate among agencies. Common language became a priority between responders, but descended into acronyms and is now affectionately referred to as alphabet soup. For example, EMS, FBI, NIMS, PIO, DMOB, you get the picture. Shortly after September 11th, the United States experienced a bioterrorism event. Anthrax-laced letters began appearing in the mail. 5 Americans were killed, and 17 became ill in what became the worst biological attack in United States history. The detection of the illness alerted authorities to be on the lookout. The attacks stopped by October of 2001. Bioterrorism isn't the only disaster we face as a nation. Massive disease outbreaks like 2008, 2009 H1N1 flu epidemic, Ebola, COVID-19, and Mpox have plagued the world. Minus COVID-19, public health's main role in responding to these outbreaks has been to monitor the number of cases of illness and to provide vaccinations to the public. Public health emergency preparedness funding is also applied towards physical disasters like hurricanes, tornadoes, and flooding. This funding also helps public health to address the opioid crisis through educational messaging and prevention activities. Okay, so this is a lot of information. How about this? In layman's terms, emergency preparedness is thinking about the rain clouds on a sunny day. Over the last several years, we've learned one important fact about emergency preparedness. Every person in the community has a role. We ask that you celebrate Preparedness Month by doing the following. Sign up for alerts and warnings. Make sure the settings suit you. So if you can use an app, get the app. Save for a rainy day. No one wants to think that their house will burn down or a flood will require they replace their floors and drywall, but it does happen, as many Nebraskans learned during the 2019 flood. Practice emergency drills. Fire drills with your kids in your house. How do you get out? Do you know where to go when you are out? Can you safely get your animals out? Test your family communication plan. Protect your important documents. Are they in a waterproof container? What are the documents that can't be replaced? In an emergency, are you able to quickly grab those documents without putting yourself in harm's way? Make your home safer. Make sure your smoke detectors work. Do you have a CO2 detector? If you don't have power for several days, do you have a way to power necessary medical equipment? Know your local evacuation routes. If there's a chemical spill, do you know where you need to go and how to get there? Assemble or update your supplies. Make sure that you have water and non-perishables in your home. Know what supplies you need in certain emergency situations. Get involved in your community. Everyone needs a helping hand once in a while, and volunteering is an excellent way to participate. Document and insure your property. Be sure that future you isn't cursing present you for not taking the time to insure your valuables. Doing a bit of paperwork to ensure that you can afford to fix your house and replace your valuables is worth the time and energy. Make a plan with your neighbors. One way to ensure that everyone is accounted for is to make a plan. If someone outside those living with you knows that you aren't accounted for, then someone knows to look for you. Two Rivers Public Health Department is happy to help you make your own plan to be prepared. And in honor of Patriots Day, we would like to thank all of our emergency responders for the work they do every day.